Morning, everyone. Nurse Mike here, World Heavyweight Champion of Nurses, coming at you. And I am now 5 days post-op from my vertical sleeve gastrectomy. I'm sitting outside because it's beautiful today. It's about, I don't know, warm, sunny, and it's good to be outside. Fresh air helps everything. But so a little update. Obviously, I'm not doing too bad. It's 5 days post-surgery. I'm home. I was home in 3. I have to say, I had my operation on Long Island with Dr. Buchan, who has done vertical sleeves on a lot of people I know. I am a nurse, obviously. I work in trauma. I've worked in emergency medicine. I've worked in medical surgical floors. So I know the care that you're supposed to receive in the hospital, and I know the care that I expect. And I have to say that top to bottom, from pre-surge to surgery to post-op to care on the floor, everything was phenomenal. The nurses were great. They know how to deal with bariatric patients. I was lucky enough to have my own room, which, of course, if you've ever been in a hospital, having your own room is wonderful. Nobody bothered me. I think the first night they woke me up twice, which was okay because I wasn't sleeping great to begin with. They did have me on a PCA pump, which is patient-controlled analgesia, which is basically after surgery you're hooked up to an IV and there's a narcotic medication in a pump, and you hit the button and it gives you a dose of the narcotic. They said that I wasn't using it very much. I thought I was hitting it too much. Either way, I didn't have much pain, so I was good. So after about 2 days, they discontinued that and was giving me non-narcotic pain medication through the IV also, which was fine. My pain was minimal, to be honest. I don't know if I have a high pain tolerance. I don't think I do. I mean, I get a splinter and it annoys me. But my pain's been okay. What I have found as I've been home and convalescing, I suppose, is the gas pain is a problem. Not a bad problem, but I find myself burping a lot. Thankfully, my wife is okay with it. But that's really the only thing. What I do find is, when we were, any of us, when we get hungry, we get that rumbling in your stomach. Now, whether that's from gastric acid, just kind of swimming around with nothing to attack, I don't know. What I'm finding now is my belly is constantly rumbling. Now, I know just from my medical knowledge that it's not my stomach. A lot of it's my intestines. I also know that they beat the crap out of me during surgery. They do. It's surgery. It's what they do. So I don't know if my belly's just mad at me and making a lot of noise. I interestingly enough find that I am not hungry, to be honest. I'm drinking about 3 ounces an hour, whether that be water or diet Snapple. That's what my doc said I can have. Add into that now protein shakes. Basically, I make 1 protein shake and drink it breakfast, lunch, and dinner. So it's only the 1 shake all day. It's about 2.5 scoops of the protein. I use Isopure. It's what my physician recommended. He also likes Unjury. That's Unjury. Whatever works for you and your physicians, go with that. I'm not going to say I don't endorse one or the other. If he said to use Myoplex Super Protein, well, I would use that. This is what my guy says to use. This is what I use. I don't think he's getting a kickback. I don't care. The taste isn't terrible. And I'm full, and that's the crazy thing. I have hypocalcemia, which means I have low calcium. Traditionally, I had a thyroid surgery. It affected my calcium levels. Fine. I take calcium every day. So now I take a calcium chewable. I also take a multivitamin. I also take a Protonix. And for me, because of my thyroid, I take Synthroid. So that's 4 different medications I take throughout the day. It's crazy that a pill fills you up, I'm sorry. That was a thing on my phone. So I don't know, I take one of those chews and I have a little liquid and I'm full, which is fantastic. Now I understand that the sleeve will stretch. And really, at this point, it's not a question of the sleeve stretching. It's a question of, and you all need to understand this, when you are able in the first week or two to get more fluid in, or to get more soft in, or yogurt in, or whatever your doc lets you ingest, it's not a question of you stretching your sleeve just yet. The fact of the matter is that there is a tremendous amount of edema or swelling going on in your sleeve, and when you are healing, that recedes, that goes down. So you're able to take in more, which is fine. At the end of 2 weeks, my doc wants me taking in 64 ounces of fluid. Right now, I don't know if I could. A week from now, sure, I don't see why not. One more thing I want to address, because I see it a lot on the message boards, is the surgical incisions. Now, a lot of people, a lot of physicians use what's called Steri-Strips. Okay, they're little thin pieces of gauze, basically, that are sticky, that cover your incision sites. They're meant to hold together the parts of the skin and maintain that. Some use sutures or stitches, and they stitch that, and then they put the Steri-Strips over that. Both of those are great. Those are great ways to go. My physician, he has used what's called Dermabond, or glue. The funny thing is, the little research I've done in the past, and I've used Dermabond on patients. I've used it for patients with lacerations and stuff. The chemical composition between Dermabond and Crazy Glue is like one molecule. That makes it safe for humans, which I always thought was hilarious. So I got Crazy Glue all over my belly. Whatever you do, don't touch it. Whether it's Dermabond, whether it's Steri-Strips, whether it's stitches, don't touch it. If you touch it, it comes out. Steri-Strips will fall off on their own. If they fall off, don't freak out. I got glue on my belly. If the glue falls off, don't freak out. When you need to freak out is if those incisions look open. So if you have a Steri-Strip on and you have sutures or you have Dermabond and it falls off and you see a hole where there shouldn't be a hole, call your physician. Okay? It may require that they put some new Steri-Strips on. It may be nothing. If the Steri-Strip falls off and you can't see inside of yourself, that's a good thing. Go with it. Forget about it. Move on. Steri-Strips fall off. It's what they're supposed to do. Check with your physicians about sutures, about stitches, if they're dissolvable or not dissolvable, if they have to come out. Because if they're dissolvable and they fall out, well, that's okay. That's supposed to happen. One thing you want to look for on your incisions is redness. And not necessarily in a day or two. I mean, the first day or two, you're going to have that. But, you know, if you're 3 or 4 days out and it looks red and swollen and inflamed and you touch it and it hurts, that's kind of a sign of infection, and you might want to get that checked out. I preempt all these things I say by always saying, check with your physician first, or your PA, or your NP, or whoever's doing the care for you. Check with them, okay? At the end of the day, they are monitoring your care. I am not. I only give suggestions based on my personal story and my history of healthcare. So at this point, I'm 5 days out. I'm about 40 ounces of fluid a day, plus my shakes. I'm getting all my medications. I'm walking a lot because you're supposed to. That helps with gas. It helps with mobility. It helps with preventing venous thrombosis, which is deadly, so you want to avoid that. But all in all, I really can't complain that much. You know, I've taken off some time from work, but I feel like I could go to work today. I don't. You know, I'd probably pass out at my desk from, you know, being tired. I'm able to sleep at home, which is nice. But all in all, I mean, not a bad experience, you know, I gotta say. I think I went into surgery at about 11 o'clock in the morning, and I didn't wake up till 7. Now, my family tells me that I was up in the recovery room and I was talking and chatting. I don't remember any of that. You know, that's okay. Anesthesia's great. So again, I will check in again. I have my first post-op visit on June 2nd. I know that I'm already losing weight. One more thing that I'll discuss briefly, because I'm already 9.5 minutes in and nobody wants to watch all this. But if you ever read NSV, okay, you see that a lot on the message board, see it a lot on the bariatric surgery sites. NSV means non-surgical victory, okay? What does that mean? Basically, everybody, non-scale victory. That's what that is. NSV, non-scale victory. Everybody always thinks that getting on the scale and seeing a lower number is a victory. I guess it is, but the non-scale victories are important too. For instance, for me, I have a watch, okay? When I bought the watch, it was very, very, very tight. Okay, that was a few weeks ago. Now I put the watch on, and I got room to move. It's a non-scale victory. It means I'm losing weight throughout my body. Okay, the fact that I can put on a shirt that was snug 2 weeks ago and today isn't, non-scale victory. My watch is talking to me. It says I need to move more. Ha! My ultimate non-scale victory is to be able to fit into my Army uniform from, I think, 15 years ago. That's when I was at my lightest. That's when I was at my fittest. That's going to be my goal. And I guarantee you guys will see that when it happens. But all in all, doing well. If you guys want to see more of this, let me know. I'm sitting around doing nothing for a few weeks. I'm happy to make these videos. I'm happy to give you guys advice. Take it or not. Most of the time I wouldn't, because I don't listen to me half the time. But hope you're all doing well, and stay safe.